Not to kick at me, I've been make a poor people.
Oh, Finemia guy. FPF for me lelo. Robenya vile jojo. Jajradona Siana 2025. Ya for mile le rehearsal so there le jajado. Mile me ya fide ko mile.
Oh, Nyatefia. You may be in my register at Dallas 2025. Because that's the only way my tongue get access to their hotel. I can't really worry. No, you may register this year. Can I never job? Hey, my tongue at the convention or would they refund my money to me?
What true for now? Never and Ghana registration. I've another two more down my temple convention the Canaswa. We are cool living out when you now your convention organizers. Then I know my other than what true for now. And I've been your happy August 2025 now do about don't hold wake out Katan.
Oh, Nyatefia.
Nyatefe nyakwe mi onu. Bekwe fefe be di fefe tem yakwe mi date ekwe here August 13, 2025. No nya yoko wa cancel hotel reservations akwa akana.
You know what? You're too early to register for the convention now. Convention is update in August 2025.
Our phone and the registration. Ekpana de Siana Movena would do near as an outie. Uhala Apo Hotel Benny Fede and
Oh, I've been out there for you. We need to my register. My way, Kaba, my young Ovinji Bomita, a pato gripe, Colobadi. What you know, register, Namia Fansa, every
Efo, eho go bankolo, yami, yame when me yom ya befu meto when me a register me a vadala. Azalo.
Hello. Miawezo. Welcome to the Health and Wellness Hub. Today is another day, and we are here together to learn about how to take care of ourselves. So, Egbe, today we're going to be talking about prostate cancer. Yes, we've been hearing about prostate cancer. What is prostate cancer? What do you know about prostate cancer? So, we have a special guest here who is not, we are all familiar with, Asiana, who is going to be talking to us about prostate cancer. So welcome. This is the Health and Wellness Hub. My name is Miss Dell. And even as you know, we always have our sister here, Davi Sarah, who is going to give us a motivational message for the week. So without wasting much time, Davi Sarah, please give us your message for this weekend and for the entire week.
Thank you so much. Akpekakaka Miss Dell. Miatwa mihogbelo indi nami azo efeye nami ke yes efeyo jogbenui meji jogbenui nami jijo ngoyiyi alamesese ye egbe miabo jidefonya ke mejibe makove nami enye akpedada thankfulness. Yes, we want thankfulness to be a lifestyle. Mijibe akpedadala nezu miawo nonome alo miagbe nonoke nomilela miko akpedada kokpede. Thankfulness for everything that happens to us, and especially to the Spirit of God. Miadakbena mau gbogboke ele miame elabe mau gbogbola ele nugede wonami. He's doing a lot for us without us even knowing. Ye mejibe ma dobela nukelta mebe mi abiama ogbogbo akpedada ne mi da akpechala ne mi abiama ogbogbo bela nifia afodofe mi nifia mommi. He should lead us and guide us in all that we do. And then the other thing I want to add to it is being open-minded. Yes. Being open-minded is a very big part of walking this walk in this life. Be mi humiado kwime ne mi nyabela nusianu antoajo, which means all things are possible. And so if we are open-minded, we are open to all possibilities and all the ways that the Spirit can guide and lead us and give us ideas as to what to do about whatever situation we are in. sta nyake me gbo efu gbe me ku ye kwenye bela ne mi vumi adoku ime na ma ogbogbo emi china ma ogbogbo bela me vudoku nye me now me dasile nye to nye khose unple nye mopopo emele susu pleji koko dade wo jibere na fia motofem na fia afodofem na fia elekumano agbe hiwa nyonam hiwa vivinam hiwa jejinam la. Then when the guidance come alone mo popo la vai la to akpo ejesi ma atefli de mebe o eke benyemo moke manto antoni because God's ways are many. Ma wo mo subo ewu miao susu miao tamebubun. God's ways are many. His thoughts are high above ours, as high as the heavens are above the earth. And so it is logical to understand that the possibilities that God has, or the Spirit of God has to guide us, are so many and beyond our human understanding and perception. Osubo alegbegbe bela miawa megbeto susu manto anlio egoglo ekeke yetala nemi vumiado kwime. When we open ourselves and allow or say, tell the Spirit that I am open to all possibilities, then that allows all possibilities to happen, because people abe all things are possible. People abe nu sianu antanjo le maupe gbogbo plemun seme tala nemi vumiado kwime bela e modestia de mau gbogbo jibe ya toji ako airam ako akpede nyemu ako fia afodofe mla me fudoku nyeme na emopopo kemi la. Then when the guidance come alo nemo popola vala la nto akpo ejesi, then you will not rationalize it, you will not overlook it, you will not rule it out that this is not the way that God can use to guide me or bless me. I don't know whether that makes sense. Bella, you just open yourself up and say, since God's ways are many, mawo mo subo, nye susuman ton aliu, mawo mo goglo, ye tala me fudoku nyeme. Bella, mao bobo emosianu, hilanton ato, ako yiram, ako fia fodofem, ako fia mokwamu guidance, direction, whatever, ideas. La bobela wo gbogboche lanton afia mo elabe ma gbogbo le nufo na mi zigedega ke mele po elabe mi osusu le chichi na mi bela o ma mantonza mo popo kemio ma antonza wo futo krache ako ayira ako fia mo popo ako aglo nyahome do now. You know, you can use your enemies to bless you, to give you advice, to give you counsel, or a stranger. Amesi menyao atu amedele mojiko aglonyade na. Ne kwa vevie bem evudoku be mauni fonu na ikola. Mawanto ako adabaku okrache ako glonyade. Wa avuvuo abe nuke bia melero. Nuke mi adabaku kemi doing. So let us not miss our blessings this year because we rationalize things. We overlook and we're using our human logic. Our human logic is so small. God's wisdom is great and vast. Let us depend and be open to the ways God can reach us with guidance and wisdom and ideas on how to improve our life and access our blessing. Mi vumi adokume ne ma gboko kokwe ne nton ahlonu mi ne nton afia afodo hwelmi ne nton afia nusiomi lebabia la ne nton adomi agbalo ta nyenya kwe kwe akpenami.
Oh, Akpe Davi Sarah, thank you so much. Thank you. Akpe now. Davi Sarah, Akpedada, Thanksgiving is very important. When we get into the mood of Thanksgiving, as she said, we are opening up our spirit for God to speak to us, and God can use anybody or any circumstances to talk to us. Thank you so much, Davi Sarah. All right. At this moment, we'll take another short commercial break, and then we'll come back and introduce our special guest in the studio. Stay tuned, don't go anywhere.
De wonye wodre kuku kple taɖodzi be yawɔ dɔ abe lãmesẽdɔwɔla ene. De nele klalo be yaxɔ hehe yi ana be mɔnukpɔkpɔ nasu asiwo be nawɔ dɔ abe lãmesẽdɔwɔla enea. Ekema mɔnukpɔkpɔ va na wo be nato kɔsiɖa eve ƒe hehe nana tɔxɛ yi ana wo ɖaseɖigbalẽ be nate nu awɔ dɔ le New Jersey le Yevu dukɔ me. Tɔwo koe nye be naƒo ɖokuiwo ɖe hehe nana tɔxɛ ya me yi dzi New Jersey Board of Nursing Dashido. Nufiala kpɔ nuteƒewo le lãmesẽ nyawo me akplɔ wo ato hehe nana ya me woafia wo afɔɖoƒe tɔxɛwo kple aɖaŋudeto yi ana be nuteƒekpɔkpɔ na asu asi wo be nawɔ dɔ le xexea me godoo. Le hehe nana ya ma woa ana wo mɔnukpɔkpɔ yi awoe be nate nu ade nu yiwo katã srɔ̃m ne le atome enumake eye le kɔsiɖa eve megbea ɖaseɖigbalẽ asu asiwo be na awɔ dɔ akpɔ dɔnɔwo dzi le aƒewo me yi nye Home Health Aid. Megana be mɔnukpɔkpɔ ya nato nuwo ayi o. Tɔwo koe nye be nayɔ kaƒodzesi yawo hena ŋkɔŋɔŋlɔ alo nenye be egahiãna numekɔkɔ bubu. Yɔ 862558464 alo 848-218-1555. Atenu agayɔ 773-960-5416. Alo naro email de pccshhtrainingschool@gmail.com. Alo newmanpccsinfo@gmail.com. Chokaba megana be mɔnukpɔkpɔ ya natonu ayi.
Welcome back. This is the Health and Wellness Hub. Yes, my name is Miss Dell, and today we're going to be talking about prostate cancer. What do you know about prostate cancer, and what is prostate cancer? So our special guest in the studio today is Dr. Kenneth Kapui Afenya. He completed medical school at the University of Ghana before moving to New York in 2004, where he completed his internal medicine residency at the Brooklyn Hospital Center. After residency, he relocated to Tennessee, where he served as the medical staff president at Baptist Memorial Hospital in Trenton. Dr. Afenya later moved to Lexington, where he completed his nephrology fellowship through the University of Kentucky College of Medicine. So this short introduction or this short profile tells us that he is a very seasoned and well-experienced doctor who didn't just graduate from medical school like a year or two ago. He's been working for years, and he knows what he's talking about or what he's going to be talking to us about. Very experienced. So without much wasting time, wasting much time, Dr. Afenya, welcome. Let me see. There we go. Okay, welcome, Dr. Afenya Wezo.
Yo. Akpagaka, thank you very much for that kind introduction. And we'll see what we can do with the topic. And I'm hoping that we get more questions and some kind of interaction if needed.
Exactly. Okay. So before he starts, please, you're welcome. Please send your comments and your questions in the chat, and we'll see it when he's done with the presentation. He's going to take the questions and your comments. So thank you. So.
All right. Now we can start with a slideshow.
Okay, then.
So whilst we wait for the slideshow, I just want to say that for some of us, I'm sure we hear a lot about prostate cancer, but then we don't really know about it because you don't have that peculiar experience regarding prostate cancer. So today we're going to try as much as possible to discuss what exactly prostate cancer is, what we can do. Now, even if you're a female, this topic is very, very important to you, because I know a lot of people who, one way or the other, would think that, oh, this is for male, but it's also for the females, because males in particular, they don't like going to see the doctor. So it is the responsibility of the female, whether a sister, a brother, or someone who is supposed to get hold of the male and then say, hey, come, let's go and see the doctor. So let's begin by looking at the objective. Next slide. So our first goal is to try and understand the anatomy of the prostate gland, because that's where the cancer is. Then we will look at prostate cancer by itself. We would visit the factors that, predisposes somebody to prostate cancer. We will look at the signs and symptoms. If you have prostate cancer, what are the things that you have to look out for? And what are the things that your doctor will see? So the things that your doctor will see are the signs. The symptoms are what you are going to tell the doctor that I have this, I have that. Then we'll look at the screening. Okay, so for instance, it's because it's a slow growing disease, you want to look out for it so that you can catch it early. The earlier you catch it, the better you're able to do something about it. And then finally, we will look at the treatment of prostate cancer. Next slide. So this is the prostate gland. The prostate gland. It's only in males. Females do not have a prostate gland. When you look at the anatomy very well, you realize that this is the whole male anatomy, and where the pointer is, that's the bladder. This is the bladder. When urine is formed, urine is stored here, and then once it is full, you get a sensation, and then you go and you urinate. So the prostate gland is located below the bladder, and this is what I'm pointing to with a pointer. And where the back of it is where your rectum is. That's where number 2 comes through. So number 1 is from here where you urinate, and then when you have to defecate, you go use number 2. So if you put your finger here, you locate the prostate gland right there. And the function of the prostate gland is that before semen is produced, the prostate gland will have to secrete some fluid and mix with the semen before it is released. So it plays a very important role in reproduction. So like I said, it's only found in males. So now that we know, we'll go to the next slide. So what is prostate cancer? Prostate cancer is just abnormal cell growth in the prostate gland. So if you look at the initial picture I showed, you see that here, this picture is showing you the prostate gland, and we have 2 slides here. One is the normal prostate, and then the second one is the diseased prostate. So the normal prostate, you don't have anything in it, but the disease one, which is a cancer, you see something here like that. And so cancer cancer cells are abnormal, and so that's why they grow really fast, and sometimes they can even spread from where they are located to different parts of the body. For instance, if you have this cancer cell that I'm circling here, this cell can spread to any part of your body. The most common part, sometimes to the bone. And so the earlier you catch it, if you catch it here, then you can do something about it before it starts spreading. So now that we know the prostate gland, we have an idea of what prostate cancer is. Let's go to the next slide. So risk factors. This is very dicey because we're talking about, so what are some of the things that will make you predisposed to developing prostate cancer? Next slide. So age. I put here first, men less than 40. Prostate cancer, it's very rare. It doesn't mean it will not happen, but mostly people who are age less than 40 years old typically would not have prostate cancer. So to the extent that when you are less than 40, most people would not be screening or be looking out for prostate cancer. But once in a while, there'll be some few people who would have prostate cancer. So, and I'm certain, unless you are in the medical field, most people below 40 would hear, oh, maybe my father or my uncle or somebody. Prostate cancer would never be one of the reasons that they will be seeking healthcare. They won't think about it at all. So below the age of 40, you're less likely to have prostate cancer. But of course, there is never in medicine. Once in a while, you see somebody who is 35 or 30 years old, for some unknown reason, would have prostate cancer, but it's not very common. Now, once you hit age 50 and above, the likelihood of having prostate cancer becomes very high. And so most of the time, that is where we start screening for prostate cancer. Now, when you hit the age of 65, let's say that is when it gets very high. So if you take all men who are older than 65, the risk will be 6 out of 10, not the incident in the whole male population, but just the people who are 65 and above. The likelihood of getting prostate cancer becomes very, very high. And so that is when screening becomes very important. So age, of course, that's why some people will say that if you live longer as a man, you are likely to develop prostate cancer. Next slide. So what are the other risk factors apart from age? Family history. There are some families, prostate cancer run in the family. You have maybe my brother had prostate cancer, my father had prostate cancer, or an uncle had a prostate cancer. So it means that that family, they have a genetic predisposition. And so it will run in some family. And you see somebody who say that, oh, my dad had it, my grandfather had it, but it's not completely so. And you can have situations where your grandfather had it, your father didn't get it, and then now you have it. So it is not necessarily transferring in that sequence. Some generations will be missed. Now, apart from family history, we also have genetic predisposition. There are some people based on either some form of deletion or mutation, also we call mutation in science, means that some genes have been abnormally cloned, and so there is a mutation in that gene. And so those mutation in the gene will predispose an individual to getting a prostate cancer. So family history, genetic predisposition. The other one is lifestyle. Lifestyle, unfortunately, has a lot to do with a lot of diseases that we carry. And so you talk about things like diet. So diet, some form of diet. It's not, people who eat high fiber diet and things would not have predisposition to cancer. There are some lifestyle things like diet that is important. So that's also things that we need to look at. Then apart from diet, smoking unfortunately has been linked with a lot of cancer, and prostate cancer is one of them that has been linked to. Unlike lung cancer, where instead of saying there is an association or there is a causative effect, meaning that a long time ago we used to say that if you have lung cancer, smoking was associated with lung cancer. Now we have changed it. We said smoking causes lung cancer. We cannot say that categorically for prostate cancer. We can still only say that prostate cancer is linked to or associated with smoking, but not necessarily that if you smoke, you develop prostate cancer. And also, of course, lung cancer, not everyone that smokes will develop lung cancer, but now we know that smoking will cause lung cancer. The other thing is alcohol. Again, alcohol is one of those things that can predispose you to so many things. And prostate cancer is also one of the things that, if you drink alcohol, you're predisposed to, developing a prostate cancer. Next slide. So this one talks about race. It's been found that prostate cancer is more prevalent in blacks more than white, and then Hispanic in that order. We really don't know why the prevalence is so high in Black people, but statistics that we collect from data reveal that we have more of that. It might be some socioeconomic reason, but we really don't know exactly why the prevalence of prostate cancer is more common in Blacks as compared to whites and Hispanics. Next slide. Is there any question here before we go on, or do we have a break coming up soon?
Yeah, if you can go ahead, doctor. So when we're done, we take a break and then we can take the question.
No problem. So the next thing is signs and symptoms. This is where it's very, very important for us. Sometimes family members and things, when they start complaining of some of these things, you need to be very vigilant. So let's say you have an uncle or your father or somebody that is related to you, your husband, and they start complaining of some of these symptoms. The first one is difficulty starting urination. Again, if you remember why I brought the first slide, the location of the prostate gland, you realize that it's directly below the bladder. And so if you have to pee and there is some disease in a prostate gland, it obstructs the flow of urine. So they'll complain that anytime I go, I feel like I have to pee, but when I go, I don't pee adequately because I feel like I still have some urine there. Now, then the next one is weak or interrupted flow of urine. So you pee and then it's the same thing. The pee is not coming out. And again, it's because of where the prostate gland is located in relation to the bladder. And so anytime you have to pee, you have difficulty. The other symptoms is people with prostate cancer will wake up a lot in the night to pee. So they have several sessions of going to maybe normally for you, if you go to the bathroom maybe 1 to 2 times in the night, now you're going like 4 times, 5 times in the middle of the night, waking up to go and pee. The next one is trouble emptying the bladder completely, and that has to do with the first one I talked about. So the bladder, when it is full, we get a sensation that, hey, you got to go and pee. But if you're having difficulty like that, it might be related to not all these symptoms I'm talking about. There may be other conditions that will cause you to have this. So it's very important when you're having them to speak to your primary care doctor so that you'll be of a guide to you, because there are other diseases that can cause the same thing. The next is pain or burning during urination. So the commonest cause of this is urinary tract infection. But of course, if you have prostate cancer and that is spread to your bladder and all those things, you have that. And the next is blood in your urine or blood in a semen. Blood in semen, sometimes you will not see at all. The commonest is for you to be able to see is that you have blood in your urine. So recap all these things: difficulty, starting urination, weak and interruption flow of urine, urinating often, especially at night, trouble emptying the bladder completely, pain and burning during urination, and blood in the urine or semen. Next slide. So this slide is the most important of all the slide I've already talked about, because this is the screening for prostate cancer. You remember I said that people who are men who are less than 40 years old, the tendency of developing prostate cancer is very less. But once you get to the age 50 and above, you're likely to get it. People above 65, more likely to get it. So how do you find out if you have it or not? And that's when a screening for prostate cancer comes in. There is a test that once you're 50 or 40 and above, your primary doctor will ask you to do, and that is called a prostate specific antigen, simply PSA. PSA is very, very important. PSA, it's just that they will draw blood, send it to the lab, and they will send you the value of the PSA. Now, PSA usually should range between 0 to 4. Now, if your PSA is high, don't panic, because there are other causes of high PSA. PSA is an antigen that is produced by the prostate gland. So any kind of disease that would disrupt the normal function of the prostate gland will lead to release of PSA. So you see that if you get the information, your doctor say, oh my goodness, your PSA is elevated. Don't panic, because you still have to, it's a screening test, it's elevated. It might be some inflammation in the prostate gland, something going on. And so you need to have patient have it investigated before you'll be sure. Now, there's also something that your doctor can do, which is the digital rectal examination. And with that, what you're doing is that, remember where I show you the position of the prostate gland in the earlier slides? If you have your fingers in the where you do your number 2, the front part of that, you can feel the prostate gland. And that is an easier way, because there is some smoothness to the prostate gland. And if you feel that, you feel some bumps or something there, that is an indication that you might have a prostate cancer, and it has to be looked at. So if you would take anything from this presentation at all, this is the slide that you have to remember, that anytime you see your primary care doctor, you want to find out what is my PSA, or if you take your husband or your father to see the regular doctor, ask them, hey, I'm concerned about his prostate. What is his PSA? Then they'll look it up. And sometimes they won't tell you because they know it's normal, but you have to have an idea and know how often are they screening for it, maybe. And so that's very important. Next slide. So what are some of the ways by which we treat prostate cancer? So now you've done the screening, and unfortunately, you've been told that, hey, your father has prostate cancer, or you have prostate cancer. What are some of the things you can do? So there are 2 ways of approaching it. One is, maybe I'm old, maybe you're 83 years old. I don't think I want to put myself through surgery. So that's where you have the expectant management. With that, you do active surveillance. So all you're doing is, I know I have it, but I'm old. I'm 83 years old, or my dad is 83 years old. I don't want to do any kind of surgery. So you do what we call the watchful waiting, meaning that, and the reason why this is very important, because we know that every kind of treatment in terms of radiation, surgery, cryotherapy, all the treatments I'm going to talk about, they all have side effects, meaning that they can have complications from the surgery, or the medicines that you're taking can give you side effects. So you have to weigh your options right and say that, hey, all my kids are grown, I have grandchildren, I've seen all of them, and I really don't want to do anything about this. This decision is important because we know that prostate cancer is a slow-growing malignancy, meaning that it's a slow-growing disease. So let's say if you have prostate cancer today, the rate at which you grow very slow. So it's better to say, okay, let me not do anything and watch and have a good life. Now, the other options you have is surgery. And remember where I show you the slide where the prostate gland is located? You can have surgery. Let's assume that they found a cancer in the prostate gland. You can have what is called prostatectomy. That is removing the prostate gland, so that the reason why we're removing it is that, because remember I told you about the abnormal cell growth in the prostate gland that can spread. So the prostate cancer can easily spread to other organs and then affect the function of those organs like the bone and all those things. So the best is if you're able to remove the cancer from its location, then there is the likelihood that you prevent the spreading of the cancer. Now, sometimes you're very late at making the diagnosis, so it's spread to other surrounding organs or structures. And so that's when we do what we call the radical prostatectomy. In that case, you're removing those organs as well as the prostate gland. So because the cancer is already spread to those organs. So we talk about not doing anything. We can do surgery, prostatectomy, radical. The other option is radiation therapy. So sometimes what we use is we have external radiation therapy, and then we have internal radiation therapy. And I'll try and explain each one to you. The radiation, what you're doing is that you're using high energy in a form of radiation, and you're trying to expose, let's say, for instance, it's not like laser, but I'm just using laser as an example. You directly target where the cancer is, and then you send a beam to that part of the prostate gland. And sometimes it's able to destroy the malignant cells, which are the cancer cells. The other thing is, which is the internal one, there's something called seeding. You put some form of radiation, a form of a seed, and implant it, and then they beam. So it's bradytherapy. The brady just means short, meaning that you're exposing the cancer cells to this radiation in a very short way. You see, I don't know if anyone here has had a relative who had it before, but they'll plant this seed, and then that will help treat the prostate cancer. Now, then we have what we call the cryotherapy. Cryo just means freezing, and you freeze it. The other one that's, chemotherapy, I'm sure a lot of us have heard about chemotherapy in regards to cancer in general. But prostate cancer, you can also get chemotherapy. And then hormonal therapy. It's assumed that the hormone that is produced by men, which is called the androgen. I'm using this term because there might be some healthcare workers on site. But androgen, that is the hormone that is peculiar to male. It's believed that the cancer cell, when you have high levels of androgen, which is that hormone, that stimulates the growth of the cancer cell, and you have more, the prostate cancer can spread easily. So if you are able to modulate, make changes in some of this hormone, and so that's where that hormone therapy also helps. Then last one. So now with all this treatment, then maybe palliative or any of those things that's will be there. And so treatment, expectant, watchful waiting, radiation, surgery, cryotherapy, chemotherapy, and hormonal therapy. Next slide. Thank you. Then next slide. So this will be Q&A.
Okay.
Yeah, so we have the questions and Q&A section right now. We'll let Dr. rest for a while whilst we go through the announcement, and then we'll come back and take the questions and comments that we have.
Thank
Okay.
you.
Akpedami.
Uh-huh.
Doctor, just one question. How do you say prostate cancer in Ewe?
No, last time I was going to do a section like this completely in Ewe, and then I was like, I'm really going to struggle with this thing. And I said, prostate cancer, prostate cancer. I said, anything you want to, you can change it to another word.
Okay.
Oh, dear.
Of the screen sharing. Okay. So we'll allow Doc to rest, and then we'll just take some announcements. Okay, so this is Sienna Sienna Media channel on YouTube. We have a lot of programs that come your way. On Friday, we have African and Traditional Music Panorama. On Fridays, that's 8 p.m. Eastern Time and 7 p.m. CST. If you want to relax or have some good Friday night relaxation, just get your something to sip on and then relax and listen to this some nice African music. Okay, so that'll be for Friday, and then it's hosted by our own DJ Lawrence Mawonyega. And then on Saturday morning, after the health and weather show, we'll have FO Steve and Empress Mausi or Mama Did come your way with the Sienna Central Talk Show. And that is let me see, it's 11 a.m. to 12 noon Eastern Time. So that will be 10 a.m., 10:30 a.m. to 12 noon Central Standard Time. Right after that, we have the Dudenyo Bobobo Show. Dudenyo Bobobo Show comes your way if you want to listen to some good Bobobo music and things that are going on in Ghana. Our sister, WMFA, comes our way all the way from Ghana, and she hosts the Dudenyo Bobobo Show. That is it for Saturday. No, and then we have, after that, we have the Misro Vegbe. That is where we go and learn our dialect, our Ewe language, our rich culture and language Ewe. That is where we go. We have Dr. Wanyo, we have Dana, me, we have Da Vero, we have Attorney Cyrus, and Da Enyo. They all come away with Mr. Vegbe to teach us to be fluent in our language. All right then. And then after that, on Sunday, our sister Nicole comes away with Africulture, Africulture. Our sister Labra Nicole comes away. She has guests who come on the show to talk to us about our culture, and the various traditions that we have back home in Ghana, Togo, and Benin. All right. So basically, those are the programs that we have for you on Sienna Eweland YouTube channel. There are more shows to come from other people, and so please stay tuned and be looking out for the other shows. There's also Sienna 2025. Yes, Sienna 2025 is coming your way. This year is the 32nd annual Sienna Convention, and it's coming and it's going to happen in Dallas. In Dallas, yes, the big D. So if you haven't registered, please go and register. There's a QR code. If you look on the flyer, there's a QR code. Please go scan it and then go register. Book your hotel as well. Don't be a late comer. Make sure you register so we can prepare well for you. All right then. So that's about it for Sienna 2025. And then to our sponsor, Sienna 2025 is being sponsored by Seafred Global Services. So that's Afenya Media. And so this is one of their businesses as well, Seafred Forwarding Business. The information is on the flyer here. You can reach them on 502-353-5655. 4407 or 614-662-6977 for all your shipping needs. Any needs, if you want to ship anything back home to Ghana, please contact them and they will take very good care of you. They are also located at 2013 Fortune Drive, Lawrenceburg, Kentucky, 40342. That is their zip code and their address. So if you need any shipping services to take things back home for your family or for yourself, you have any projects going on, please reach out to Sea Freight Forwarding services and they'll take very good care of you. All right. So that's about it for our announcement. So at this time, we'll take your comments and your questions. Let's see what we have here. Okay. So we have that's a question for there was a prior question. There we go. Okay. So for Lawrence Dagadu says, watching from the city of Claremont, thanks for the solid advice, David Sarah. So that was for our motivational segment earlier on. In the end, we have Madame Vivian Newman also saying, good morning to you all. Good morning, Madame Newman. Thank you for watching. Madame Irene Allo also says, good morning, Sister Vivian and all. Good morning to you all, and thanks for watching. And so Mr. Francis Kaleji says, Doc, may I know if you keep urine for long? Okay, so he wants to know if keeping urine for long can cause prostate cancer.
Not really. Not really. There is no correlation for keeping urine for long causing prostate cancer. But it's so. For instance, if you and I think there are other conditions that can occur because you're keeping urine for long. But prostate cancer is not one of them. Well, so what will happen is that if you keep urine for long, one thing I know for sure that it's not possible for you to keep it for so long because your body you give up on it. You end up in on yourself. So that is not a possibility. The other thing that can happen when you have prostate cancer is that when you see the location, if this is the bladder, it's at the bottom of it. So, and then the urine comes this way. And so what can happen rather is that if you have prostate cancer, you have the tendency of blocking the passage to urine, and then the urine builds up, and that is the worst pain you can ever have. And then I remember, one time when I was working, somebody came like that. And once you take that pain away, the person will thank you forever. They'll keep thanking you because it's just like, assume that you have the sensation to pee, but you go and you cannot pee. Meanwhile, your body say you're looking for a bathroom. You get to the bathroom and the pee is not coming. And you have that constant sensation. I have to pee, I have to pee, I have to pee. And you're trying to just imagine that you are in a traffic and you have to pee. That's the sensation you have. Meanwhile, now you have the bathroom, but you cannot pee. And so that's what can happen. That an enlarged prostate gland or a prostate cancer can cause what we call a retention of urine. Mm-hmm.
All right, thank you. So thank you for Francis. He's watching all the way from Makachi. Thank you so much. And for Lawrence Dagadu also says, can you have an enlarged prostate without cancer?
Yes. That's and that's the reason why I was saying that when you're doing a screening or you're doing that, it's very important to know that you can just have enlargement of the prostate without having a prostate cancer. In fact, if you have that, you're fortunate because that's benign. And the urinary retention that I talked about, which could be either an acute or chronic, will be because the gland is enlarged by itself. So there's no cancer in it, but because of changes as we grow older, there is building of the gland and it becomes big, and that's the one that has the highest tendency of blocking the passage. And you see, sometimes what we do is we give you some medicine to relax the pathway, which is like Flomax, if people have heard about it. It's flowing maximally. That medicine, we give it to relax the prostate gland or the soft tissue, which is the smooth muscles, and that would let you pee easily. And so that's also a possibility. Yes.
Okay, thank you, Doc. Okay, so another question coming from Mr. Winfred Bedema. He's the president for Dallas. Thank you, Mr. President. He says, good morning. How do you determine which treatment is best?
Yeah, that's a big and a good question. That's like so that is one of the most difficult things to do. And remember earlier I talked about the person's age. Let's say, for instance, you're 80 and above, you can do the watchful waiting. Now, if the cancer, right, is already spread to the bone and is out of the prostate gland, it's advised that maybe you go chemotherapy or radiation therapy. But if you know for sure that a significant portion of the cancer is just located to the prostate gland, then surgery will be your best option. So you have to know whether the cancer is spread to other portions of the body, or it's localized, or your age. And also, let's say, for instance, somebody who is in the nursing home, bedbound or something like that. Some of those people, you say, okay, let's do watchful waiting. And so you have to consider all these factors, functionality, and those things to determine which one. And I think this is a very good question. And it's one of the difficult things we face all the time when we tell patients that they have prostate cancer, and now we have to determine which route to go in their management.
Okay, good. Thanks, Doc. Okay, so there's a follow-up question to that, and he said, if there is, how can people reduce the risk of prostate cancer? I know you talked about it earlier on about, the things to watch out for.
Yeah, some of the things we, for instance, the genetic disposition, family history, those things, we have no bearing on that. But the ones that we can do to reduce prostate cancer will be do not smoke, don't drink too much alcohol, and avoid the excessive indulgence in all unhealthy diet. Exercise will not play a big part, but all these things can just routine health maintenance. And then not only that, the screening, which I talk about, the PSA, is the most important one because you want to catch it early. You remember I said it spread from the gland to other parts of the body. So that PSA, which is a screening, should be your primary goal, that let me screen once a year to your primary doctor, so that once you see high PSA, then you want to go in and have it removed immediately.
Okay, thank you, Doc. So he was also asking, same from Mr. Winfred Bedema. He's saying, you just answered. He said, what is the role of PSA testing in detecting prostate cancer? So you just answered that. So, yes, and then the second part says, how often should it be done?
So most of the time it's done once a year. You check it once a year unless you're doing it for surveillance, sometimes every 6 months.
Mm-hmm. Okay. All right. Another question from Mr. Gbedema. He says, what are the potential side effects of prostate cancer treatment and how can they be managed?
Yeah, so based on, so for instance, if you have just the removal of the prostate gland, which is the prostatectomy, you can have a situation where you have incontinence of urine, where because of where it's going, you are not able to hold your urine because it's located close to the bladder, and some of the nerve that helped you hold your urine are now damaged, and that can happen. So it's just a good surgical technique. And of course, if you have to do chemotherapy, then it will be hair loss, easy infection because your immune system is down, and things like that.
Okay. So the last question from Mr. Winfred Bedema, and the last question we have says, what are the chances of reoccurrence of the prostate cancer after treatment, and what are the follow-up care, that is recommended?
Yeah. So once your the surgery is done and they remove the prostate gland, they usually will send that to the pathologist, who will determine whether they got everything, like all the cancer cells are gone. So if they check the margins, let's say you take the gland out, you check all the margins of the organ that is taken out, and the margins are smooth, there's no cancer cell in any of the margin, it means that the cancer cell is just inside the margin that is taken out. The chances of recurrence is very low. But if you have it spread, then it means that the cancer cell had already spread outside the confines of the gland, and that the recurrence is very high. Those ones, they can. And I have seen a few cases like that, and it's not pleasant when you think that you have taken everything out and now it's spread somewhere else.
Okay, thank you, Doc. Okay, so we have another question. I believe that should be the last one. So from another one from Efo Francis Kaleji, watching us from Akachi, he says, are there any forms of myth about prostate cancer which can be demystified? Any forms of myth? Any myths about?
yeah, and I think that's when people. Mm-hmm. So that this is also important, because I know I had a patient who once says that, if I don't know about my disease, I don't have any kind of fear. I don't know how to say it in ever. But this was a man, 55, and what he said is he would not do any screening at all. And then by the time they did the screening, the PSA was already elevated, and by the time they found out, the cancer had already spread to the bone. So if he started a screening early enough, that would have been detected and taken care of. And so I think the myth will be to think that you are beyond that disease and there is nothing that can get you, and you refuse to go for the screening.
Wow. Mm-hmm. Thank you so much. Thank you so much, Doc. So all Doc is telling us is screening is key. Mm-hmm. Please go for your screening at least once in a year. If we go for the screening and there's nothing, we know we don't have anything. But if there's anything too, early detection is key. Our doctors, our health professionals keep telling us, early detection is key for any form of cancer or disease or sickness. So the screening, the health checks are very, very important. Thank you so much. Doc. We really appreciate you. Thanks for your information. These are very informative that we have to be practical and intentional about. Mm-hmm. I mean, this is 2025. We are in the new year. So please, if 2024, you weren't intentional about it, please be intentional about it this year. Make sure you're using your health insurance. Go and get checked. Let's go get checked, please. All right. Akpanami, thank you all so much. Our time is way past. We've been eating into another program's time. Thank you so much, Doc. And we know it's been informational, informative. We appreciate it. and we are going to pass this information on to our relatives, our friends, and our loved ones, so we all stay healthy and alive. Akpenami, thank you. This has been the Health and Wellness Show. We've talked about prostate cancer, and our guest here has been Dr. Kenneth Afenya. Thank you so much, Dr. Afenya. We appreciate you, and thank you, cherished viewers. Until we come your way again next week, please stay healthy and be strong, and let's love each other. Akpenami. See you again next week. Bye-bye.
Bye-bye.
You are welcome to Sienna 2025. Come and have a unique experience in Dallas, Texas.
Ago na miapete milemiakpe bemifa 32nd annual Sienna Convention le Dallas Fort Worth. Dallas. Big D. Mifa yapa pong tepe. Aha. Sienna 2025. Mano bobo edolo. Mifa midwaza. We want me at the Cornwall Friday evening. Sunday me our picnic. Me our church service. And all les zanzazata miniva.
Tata nyo play before you, me do bonso anamilo. Me do bonso anami akpata, mi de kukuna mi be mi klo mi ape famille ovalo. Mi klo mi ape famille o mi afa po Dallas da. Mi adu azan. Azalo.
Azase.
Azale kongbe.